The new vaccine, developed at Baylor College of Medicine, is 90% effective against the original COVID-19 coronavirus and 80% against the Delta variant. Data on Omicron is coming. The vaccine is also cheap, refrigerator stable, and easy to manufacture in developing countries, says team co-lead Dr. Peter Hotez.
So when you start going down the checklist, this checks all the boxes for what you need for a global health vaccine.
Hotez and colleagues use the same old, tried and true technology that they've used to develop vaccines against neglected tropical diseases, those that Big Pharma is less inclined to treat, because that's what's most available to vaccine makers in low and middle income countries, he says.
That's why I was so disheartened at the beginning of the pandemic when everyone was focusing on new technologies. I knew that would be a barrier to access.
Wealthier nations poured money into making new technology vaccines. Now, about 80% of people in upper income countries have been vaccinated, but only about 10% in low income countries have. And Hotez and colleagues are making the vaccine available without patents. He says intellectual property rights just get in the way during a global crisis.
If your house is on fire and you can only have time to make one phone call, you don't call a patent attorney, you call the fire department, and we're the fire department.
The Indian government recently authorized the vaccine, and Indian company Biological E is making hundreds of millions of doses a month under the name Corbavax. Companies in Indonesia, Bangladesh, and Botswana are planning production too. But it's not clear whether Corbavax will hold up as well as the new technology vaccines against the Omicron variant, says Johns Hopkins University vaccine expert Dr. William Moss.
The Sinopharm, Sinovac vaccines, those are an older technology. They are not doing well against Omicron. Very much reduced vaccine effectiveness.
Global supplies of other vaccines are improving. The United Nations-backed COVAX program recently delivered its 1 billionth dose. Big drug makers are promising billions more doses this year. And other new vaccines are entering the market. But if it holds up against variants, a low-cost vaccine like Corbavax will still be useful, because COVID-19 will be with us for years to come, Moss says.
We'll be kind of transitioning into this kind of endemic mode and more routine vaccination, and that's where these vaccines may play a role.
Experts say a regular shot against multiple COVID-19 strains could be in everyone's future. The less it costs, the better. Steve Baragona, VOA News.